So in general surgery, we oftentimes see two common types of hernias, ventral hernias and inguinal hernias. Ventral hernias are hernias that occur anywhere along the abdominal wall, and oftentimes these arise from locations of innate weakness, say at the belly button, or can happen from an area of prior surgery or prior incisional site. The symptoms that one might experience with a hernia oftentimes involve the presence of a bulge or a knot, something that patient may feel they can push in and out. We term that a reducible hernia. And there may or may not be an aspect of pain or discomfort that's associated with that. For hernia surgery, we approach repair of hernias in two basic ways: an open or traditional approach and minimally invasive hernia surgery. We choose the type of repair that we do based upon not only the individual characteristics of that hernia, but also the characteristics of that patient that might make them a better candidate for one repair over the other, and this leads to better outcomes. Open hernia surgery involves the placement of an incision overlying that hernia itself. We reduce the hernia and its contents, and we restore the functional anatomy and the location of that hernia with either a primary suture repair or placement of a prosthetic mesh. And that mesh gives us a good, strong, tension-free repair and helps prevent rates of recurrence. Minimally invasive hernia surgery involves the same basic tenets as a traditional surgery, although it really gives us an edge on recovery. We're able to do very small incisions, oftentimes away from the location of that hernia, and it gives us the same great outcomes, although it oftentimes will allow that patient to return to work quicker and oftentimes less of a degree of pain and postoperative discomfort. It really depends on the type of hernia surgery that we do. The majority of these are done in the outpatient setting. The patient comes in that morning and oftentimes go home that afternoon. Depending upon the type of surgery we do, the recovery can vary. More minimally invasive approaches, oftentimes the patient has less a degree of pain, might take less pain medicine afterwards. In any regard, people tend to recover rather quickly with either a traditional repair or a minimally invasive repair. So if you think you might be having symptoms of a hernia, get an examination with your primary care physician, or if you want to set up an appointment directly with us, you can call our office. Our phone number is 770-834-3336.